Hey, everybody. Good morning, good evening, good afternoon. I hope you're having a blessed day. Welcome to Pep Talk, the podcast. We give you the truth, the whole truth, and nothing but the truth. So help us, God. We take all these interesting and sometimes complex and sometimes controversial conversations in healthcare and in medicine and in science, and we break them down into simple, understandable, digestive points so that you can take some massive action steps, because we know that knowledge is power, but wisdom is taking that knowledge and applying it to your life. I'm your host, Dr. Eric Naputi, 20-year functional medicine practitioner, and I know that doctor is Latin for teacher. My job is to teach, reach, inspire, and hopefully motivate as many of you to take responsibility for your health, because not only do you have the responsibility, but you have the ability to do so. On today's episode, I want to talk to you about something that's very near and dear to my heart, and truly conversations that I've been having for the past 2 decades, but big time we've been having on a global standpoint for the past 5 years. And it's really the idea that there's a massive erosion between the doctor patient relationship, and how the healthcare system, the broken system, has reared its ugly little head and tried to control the conversation, destroying the doctor patient relationship. And I'll just tell you that patients do not trust their doctors anymore. It's an all-time high. There's no trust in the system. They don't believe what doctors tell them. And I tell you, I understand why. And I think it's important that we have these common sense conversations, and we should be able to have conversations across multiple disciplines. And we need to be having conversations with people that understand different aspects of health. I was speaking to a doctor just the other day, and he made one of the most ignorant statements that I'd ever heard. He said, somebody said that medications don't make you healthy. And he said, that's a lie. There are medications that make people healthy every day. And I said, okay, well, let's redefine what our definition of health is. Because if you look at the medical dictionary, Dorland's medical dictionary, and I showed this doctor, he's a cardiologist. He was talking about statin drugs and beta blockers and all these things. And I was showing him some of the data and research, and it was almost like he was too indoctrinated. Hence the term doctor, right? To really think outside the box of the new data and research, because it conflicts what he's been told his last 20 years of practice. I said, let's go back to Dorland's medical dictionary, the definition of health. The definition of health is the body working at optimal function, physically, chemically, and neuroemotionally, not just the absence of symptoms and disease. So just because your symptoms go away because you're taking a blood pressure drug doesn't mean that's making you healthier. Just because your cholesterol gets lowered because you're taking a statin does not mean that you're healthier. You guys know that we're the only country now on the planet that still allows direct-to-consumer marketing for drugs. Okay. Every other country, you have to go through a healthcare provider to get it. What's the last 30 seconds of every drug commercial that's out there? It's the side effects that come out. Take this drug. It's going to help you with whatever problem, but... And then in a real small, quiet voice, like as fast as they could say, it's going to cause explosive diarrhea. Your eyeballs are going to fall out. You're not going to sleep. You're going to have anxiety, depression, insomnia. Your skin's going to leach. Fingers are going to fall off, but you're going to sleep better. Like, come on. We don't have common sense in many things anymore. And we definitely don't have common sense in our supposed healthcare system. So understand that in the clinic, mistrust can create an unstable situation. And I have people that come to see me from all over the globe. They know I'm a doctor. They know I think and act a little outside the box, and I'm approachable, and I have common sense conversations, and I don't just pigeonhole people to one way, but they still come in because they've been jaded and they still have a chip on their shoulder. They don't trust doctors. They just don't understand the system, but they know that something's wrong. By the way, families feel isolated. Parents have ideas of how they want to treat their children, and they get belittled or even kicked out of pediatricians' offices now. And the reason is not about health of the child. The reason is the bottom line for the health of the practice of the business for the doctor. What's the first thing that when you call a conventional doctor, they ask you, what insurance do you cover? Why should that matter? Because whatever insurance you have dictates how much they can charge you, or if they can see you as a patient. For example, there are doctors I know right now that have gotten out of every health insurance policy that's out there because it cost doctors more money to treat patients with their healthcare because of all the time, energy, and resources they have to put into writing literally pages of dictation, documentation to support the treatment of the patient. That's going to a non-doctor who hasn't seen the patient, that denies the claim 68% of the time. It is an absolute racket. It's a joke. If you let your health be dictated by the level of insurance you have, it's horrible. And those of you that think that I have to use my health insurance, I'm going to tell you something. I just had a lady yesterday who's been trying to get an MRI for 6 months. It's been canceled multiple times because she couldn't prove necessity for the doctor to get it done. They finally had the proof of it. She came in to see us earlier this week, and she was going to have to pay out of pocket $1,800 because she has a $2,500 deductible. We were able to call the MRI imaging place, got her a cash price, and for $350, she was able to get that MRI. That's wrong. That's crazy. That's just one of probably a million reasons why people don't trust the broken system anymore, and they don't trust doctors and practitioners that participate in that system because it's broken. In the United States of America alone, it's the third leading cause of death. Some research says it's number one. So I want to read off some of my notes here. So, by the way, there's a conversation of a doctor that I had just recently who sits on an ethics committee for a major healthcare system in upstate New York, where doctors and nurses frequently bring, questions about the broken system too. And let me just give you a case that he told me about. So listen to this. You got a 6-month-old child that's suffering from severe brain injury following cardiac arrest. They had a ventilator. This child's on a ventilator. A feeding tube are the only treatments really keeping him alive. These intensive treatments might prolong the child's life, but he's unlikely to survive. The mother, citing her faith in a miracle, wants to keep the child on life support, and I understand that. The clinic and the team is distressed about it, and they feel that only prolonging the child's process of dying is cruel to the child. Often, the question that the medical team struggles with is, are we obligated to continue life support treatment? By the way, bioethics meetings are happening all over the place, not just about situations like this, but also about the determinant of, is insurance going to continue to cover it? And what this individual told me was one of the major decision makers that teams of physicians have when they have to make these life support, not everyone, but life supporting decisions, is this care going to continue to be covered by the insurance or not? That's not okay. And the bioethics committees and modern academic fields are failing and have been failing our system since the 1970s. Look, I want you to understand this. There are other studies that have shown distrust has gone down massively since the outbreak of the COVID-19 pandemic. And I know that censorship is still alive and well because of that, because the people who are still in active positions are now being called out politically and legally because they lied. They lied and told us that wearing a mask was going to stop the spread of COVID. It didn't, and it doesn't. They lied and told us that these injections they were going to give us have been proven safe and effective, and they weren't. They lied when they told us that these injections that we got are going to cause people to not have side effects and symptoms, but to cause them to be immune. There are people that have had 7, 8, 9, 10 COVID shots and still get COVID 2 or 3 times a year. It's insane. How can you possibly trust a system that's lied to you? It's kind of like going back to an abusive relationship. And I have patients now that come to me and say, when I go to my doctor to talk to them about my health condition, I want to talk to them about vitamins and minerals and nutrition and exercise. And they say, oh, none of that stuff works. Just because your doctor's not trained in that technique doesn't mean that those things aren't beneficial for you. In fact, most problems you have are because of you not living the lifestyle that your body's designed for. We have a genetic blueprint of which we're supposed to live our life, how we should sleep, how we should eat, how we should exercise, how we should live. And unless you do a DNA discovery test or something to find that out, you're guessing. And we don't guess, we test. And recent surveys, listen to this, a recent survey has a big pharmaceutical company, a recent survey in a big pharmaceutical company found that mistrust of the medical system is even worse among low-income minority Americans who experience discrimination and persistent barriers to care than any other group that's out there. That's because people can't get the care that they deserve. And people say to me all the time, I wish I could. I wish I could do this, but I can't afford it. It shouldn't be expensive for you to have clean access to food or access to education or access to supplements or even medications that could save your life. It should not be. We should not have a system where the lobbyist in Washington, D.C., the lobbyists for the food industry and the pharmaceutical industry are paid 10 to 20 times more out to congressmen and women than any other lobbyist organization that's out there. It's disgusting to find out how many millions of dollars per year goes towards congressmen in order to make certain policies that benefit big food, big pharma, and big medicine. It's disgusting and it needs to stop. It's not okay, and nobody thinks it's okay. The only people who think it's okay are the ones that have sold their soul and the other ones that have bought those souls. You understand that, right? And listen, we have the definition of insanity is doing the same thing again and again and again and expecting a different result. But the reality of it is that we either have the pain of the same or the pain of the change. And we might have to suffer a little bit in the short term to transition to something new. There's always pain of change or pain of same. Our country is fat, sick, and nearly dead, and everybody else's country is following suit because they're adapting the Western lifestyle, which is causing us to be symptomatic, sick, and disgusted. Listen, our children, this is the first generation. Our children are the first generation that actually are decreasing their life expectancy than individuals in the past. Why is that? It's because of the food, the chemicals, the lack of proper education of what health really is, and access to a broken system. Even if you have health insurance, you're going to get access to a system that's broken. I can't tell you how many times I've had conversations with patients that their insurance would cover a $70,000 surgery that would put them in a permanent disability rating for the rest of their life with no guarantees of it helping, but it won't cover a couple $1,000s for the root cause physical medicine or corrective care that they really need. That's disgusting. And Medicare, which is the basic guideline for all health insurance in the United States, whatever Medicare does, the rest of the insurance companies follow suit. Medicare clearly says that any type of treatment that is there to prevent, mitigate, or reverse chronic illness is deemed not medically necessary, aka not covered by insurance. No wonder doctors aren't trained in that, because they can't get paid to do it through the insurance model that 99% of all private practicing physicians and hospitals participate in. The system is rigged against you. The COVID-19 pandemic further accelerated the public lack of trust. I mean, in the clinic, mistrust is it creates a really bad situation. And people don't go to their doctor's appointments. They miss opportunities to see where their health is because they don't trust the doctors anymore. And by the way, I don't blame them. They feel isolated. They don't get the support. They can't trust. The clinicians are in bad situations as well. It's a bad system. We need the governments to get out of our healthcare system and allow healthcare to be what it really is. Self-care is the real healthcare. The more you understand about yourself, the better you can take care of yourself. And your physician should be helping you go down that road of self-care. You need to understand that your health is a balance of physical well-being, chemical well-being, and neuro-emotional well-being. And you need to go down the self-discovery process of uncovering how you can support the deficiencies or toxicities in any of those areas of your life. And your doctors don't do that. What do? They give you more drugs, more potions, more pills. They manage your diseases. They don't care about helping you get to the root cause of the problem. And that's a fact. And you can choose to participate in that system, or you can unplug from that system and plug into a system of self-care, which is really what the world is shifting to. Listen to this. According to the National Academy of Medicine, the opportunity to attend and to ease suffering is the reason why many clinicians entered the healthcare profession in the first place. However, when doctors see their patients suffer because of mistrust, because of the system that's failed them, doctors are at a low time level of their own self-respect. I don't know if you know this, but suicide and not going into the profession of healthcare is higher than it's ever been because of these problems. We've got a dilemma of ethics. Physicians are not equally ethically obligated to provide treatments that are beneficial to their patients. And if a doctor says to you, there's nothing else that can be done to you, they need to rephrase that and say, there's nothing else that I can do for you. We need to try to help you find other providers that can help you down the journey of understanding the root cause of your problems and help you take daily action steps to improve the quality and function of your lives. You know, the sad thing is that there's a massive amount of morale distress in the healthcare industry. It's filled with litigations and accusations and assumptions that just don't need to be there, that weren't there when I got into healthcare some 20 years ago. They've progressively gotten worse as regulations have gotten more strict, and how insurance has gotten their hooks on the way that healthcare is delivered and received. And they've got the patient community convinced that the only way that people can participate in a supposed healthcare system is if your insurance covers it. Which, by the way, please remember that 50% of all bankruptcies that happen in America happen because of health-related bankruptcies. And the vast majority of those people that have health-related bankruptcies have health insurance. Just let that sink in for just a minute. The system is broken, but we can fix it. It's time to get the three-letter agencies out of our doctor-patient relationships. It's time to open up the regulations that have constricted the doctor-patient relationship. It's time to give access to patients and access to doctors, to therapeutics that are truly going to help people at a root cause. And it's time to stop the propaganda, which used to be illegal in our country, but was made legal in 2012 by the Obama administration, that the government can legally propagandize its people towards persuading them to do something that would benefit the government as opposed to benefit the individual. And that's a fact, folks. These are just things that have happened. So the difficulty is where we're at. The optimistic component is, it's time to change. I know it's time to change. Doctors know it's time to change. We're now hearing the conversation globally. It's happening in DC. It's happening all over in the European Union, all over in Europe and Asia and the Middle East. People are saying enough is enough. We want access to true healthcare, and that begins with education and knowledge, because knowledge is power, but wisdom is taking that knowledge and applying it to your life. So listen, if you agree with this conversation, I want you to like it. I want you to share it. I want you to subscribe. I want you to go to our website. Go to peptalk.world. That's peptalk.world. Make sure you're following us on all of our social media channels. Go back and rewatch this and re-listen to this and share this with your friends and family and loved ones. And if you don't agree with this, comment why you don't. And it's okay to disagree. We all have the freedom to choose, and we have the ability to use our own discernment to do what's best for us and our family, and doctors, for your patients. All right, guys, until we meet again, I'm Dr. Eric Naputi. God bless you. God bless America, and God bless the world. Stay smart out there, and I'll see you soon. Be well.